that people go through the hotline in order to book online, which makes sense, but people are having enormous difficulties with getting through, which is also understandable. But if we're telling everyone to get vaccinated as soon as possible and asking them to do it through a hotline that doesn't always work, there seems to be some problems there. What's the solution?
The hotline has now has 1,000 plus people working on it, and the extraordinary levels of demand that we saw from a few weeks ago have mitigated a bit. That's not to say that there isn't still demand issues. Clearly there are, but every piece of advice that I've got shows that increasingly those capacity issues are being dealt with. It might well mean that people have to be a little bit flexible as to when they look at when their booking is, but there is a window of space that the Australian Technical Advisory Group on Immunisation sets, and we want to make sure that having started so well in that group of 40 to 49-year-olds, that we now calibrate our efforts so as to make sure that we have a sustained effort going forward in the Pfizer vaccination groups to tick over those vaccines as and when they fall due.
Minister Foley, new figures show that Victoria has fully vaccinated the lowest percentage of its population compared to other states and territories. Does that concern you?
That we're vaccinating
the lowest percentage of second doses?
Oh, well, that's exactly why we're now calibrating the system, having started so strongly in that 40 to 49-year-old group over the last 3 weeks, making sure that based on the increased allocation of Pfizer that we've now got from the Commonwealth, and we thank them for that, that we can address precisely that issue. I do point out that the state has delivered the highest level of vaccines in the country and is currently accounting for something like 40% of the total vaccinations right around the country. What we now need to do within the allocation that the Commonwealth provide us is keep that balance of first and second doses so we can get everybody fully inoculated within the constraints of supply that we're provided.
Minister, just on vaccines again, we're hearing from some frontline workers who got the AstraZeneca jab, some younger frontline workers got the AstraZeneca jab before the ruling was made that not appropriate for younger people, and now they're struggling to get they want to take the Pfizer jab and they can't because they've already had the AstraZeneca jab and they're worried, they don't want to do it. What's your response to that? Is there any leeway there, or what's your response?
Well, the Commonwealth's vaccination program and that cut-off of the AstraZeneca for over 50s and the Pfizer for under 50s is a National Cabinet arrangement, and in terms of how prior to that arrangements went as to who got what, that mixing and matching issue is also an issue that the Australian Technical Advisory Group on Immunisations has advised on, and their advice nationally is that you should continue for the vaccine that you have initially been provided. So until such time as those rules change, they're the rules that the states and jurisdictions have to operate under. That the Delta?
Delta.
So as I understand it, both CQV and the Department of Health were running down all of those. You recall Professor Cheng highlighted the 4 strains of inquiry, and work continues on all of those, quite substantial work, and some of those lines of inquiry are being closed off. But as we stand here today, none of those have established precisely what that crossover point has been.
And of those four working theories, does one hold up more than the others?
I'd have to get people who are more across the technicalities of these things, but all 4, I think Professor Cheng indicated which were more likely or not at the time, but all extensive work going back on work is still being done on all of them, but as yet none of them have shown anything that points to a crossover point.
Is there still a supply constraint with the Pfizer vaccines as well? Given people are a bit less hesitant to get the jab, would it be helpful if the federal government gave Victoria more to get those first doses rolling?
Oh, look, Victoria will distribute whatever it's provided when it comes to the vaccinations. Not just our state clinics, our GP networks are also calling for more vaccines. And of course, other distribution points such as community pharmacies and others are also very keen. But the truth is we are operating under the constraints of what we are being provided. And that's an issue for the Commonwealth Government. Having said that, we're very pleased that because Victoria's been able to demonstrate such an appetite for the vaccines, that we have been allocated some extra, and we will continue to get those out the door as quickly and as safely as we possibly can.